silent killers. Silent killers. And the question is, what is silent killer? Silent killers are diseases or conditions that may progress to a very advanced stage without or before they advance in age, in their stage, no signs and no symptoms, or they might give you a mild signs and symptoms. And some of these warning signs are disguised, and it's better to prevent them before curing it or before the thing advanced. So, and I have a lot of it here. I have high blood pressure, diabetics, fatty liver disease, osteoporosis, cancer, coronary artery disease, obstructive sleep apnea, hepatitis, glaucoma, stress, and deep vein thrombosis. And I pray God will help me with the time given to me. All right, so let's start. High blood pressure. High blood pressure, one will ask, well, what's the range for high blood pressure? The range starts from 140/90 millimeter mercury and above. High blood pressure is the same thing with hypertension. Okay, so some risk factors that aggravate these high blood pressures are smoking, stress, drinking alcohol, high salt intake, birth control pills, adrenal disease, kidney disease, and some pregnancies aggravate to this high blood pressure. Some symptoms are shortness of breath, constant headaches, nose bleeding, blurred vision, which might lead to what we call hypertensive retinopathies. It is essential to control this because when it is not controlled, can lead to what we call stroke, heart attack, and other diseases that high blood pressure affects. Then we moved on to diabetes. Diabetes is the same thing as diabetic mellitus. It's the inability of the body to convert glucose to glucogen. Okay, sorry. Inability of the body to convert glucose to glucogen. And the hormone that converts that is called the insulin. Excessive sugar in the blood are caused to be diabetes. So we have type 1 and type 2 diabetes mellitus. Type 1 diabetes mellitus, the body has little or no insulin, while the diabetic type 2 is a chronic one that the body cannot produce insulin. And type 1 diabetes mellitus is taken care with medications, or you watch the food you take, while type 2 diabetic mellitus are controlled by injection of insulin. Then the next question on diabetes is, how do you know some signs of diabetes, symptoms? Because symptoms are the things you experience, while the signs is what the doctor, or when you run tests, what they see. Increase in thirst, weight loss, frequent urination, blurred vision, sores or injuries that don't heal. Then in men, it can cause what we call loss of sex drive, erectile dysfunction, poor muscle strength. Then diabetes also can be seen in the people that has a high risk of diabetes are overweight people, obesity. People that is above 45 and above. But people below 45 or children can still have diabetes, type 1 diabetes, which has to do with family history. If there's a family history of diabetes, younger one can still experience that. People that don't exercise, because I noticed even when the sister said my hair might, some people are not doing that. So people that don't exercise to burn out some fats are in a high risk of that, BP and high cholesterol. So diabetes can lead to what I want to mention now: stroke, heart disease, neuropathy, retinopathy, loss of vision, what we call diabetic retinopathy, foot damage, because when the sore are not healing, either they cut your leg or any part of the skin. Then skin damage and also kidney diseases. So there's some herbs that helps to control diabetes, like bitter leaf, as all it's known, then scent leaf, aloe vera, and okra. Some people might open their eyes. Okra, yes, okra contains a lot of an antioxidant, which helps to control diabetes. So treatments are with medications and insulin intake. And whenever you notice any of this sign, please quickly go to hospital and contact your doctor. Next one is fatty liver disease. Fatty liver disease are inability for the liver to break down some fats deposits around it. So we have alcohol and non-alcohol liver disease. People that have chances of getting this liver disease are people that has gastric bypass, high cholesterol, diabetes, drinking of too much alcohol, smokers, people taking food with too much of salt, high salt intake, and over-the-counter prescriptions, unsaturated fats. And this can be dictated by blood sample and ultrasound. There's some food that will help us to regulate this fatty liver disease. Lots of fruits and vegetables. Food filled with fibers, high fibers, like legumes and whole grains. Low salt, because I find that a lot of people like salt. So salt causes a lot of things in the body. And no alcohol. Okay, so there's some herbs that helps in that too. Some people, but some of the times, if I mention some of the herbs, so that you will not indulge in too much of it, and you know that too much of everything is not good. So some herbs that helps, like turmeric, are good, beetroot, and ginger. Then the next one is called osteoporosis. Osteoporosis has to do with bones. These osteoporosis are diseases of the bone that causes the bone to be brittle and thin. The symptoms there are people that experience backbone, people that has problem in posture, bone fractures. These are caused by people that doesn't do exercise, poor diet, smoking, and family history. So some things that you can get right of these osteoporosis, things that you take that can help you. Food that contains a lot of magnesium, calcium, vitamin K, vitamin D, omega-3. One will ask me, where do you get omega-3? We'll have the tablets. And also fish contains more of omega-3. Then people that exercise. Remember that I said osteoporosis is about the bone. Exercise, I find out that people don't jog, walk, climbing the stairs, and dance too can still be part of the exercise that helps. Number 3 is cancer. Cancer, as all known, is a deadly disease, and is a disease that can come without giving you any signs or symptoms. And there's some people that has a high risk of them and will have some mild symptoms, which when you notice that, you run down to your doctors. There is a word, there change in bowel sound or bladder, a sore that refuses to heal, thickening or lumps in the breast. When you notice any pain around the breast, please, you go for medical checkup. Then indigestion and difficulty to swallow, obvious change in mood, and some nagging cough or dry coughs. Cancer can lead to death and can still be avoided. There's some things that you use to prevent cancer. Avoid tobacco for people that smoke. People that can't eat, please eat properly and eat balanced food rich in vegetables and fruits. Avoid alcohol because there are risks in mouth and liver cancer. Then avoid exposure to radiations, X-rays, because there's some people, small thing, they want to do X-ray, they want to expose their body system to radiation. All these are prone to cancer. Avoid some industrial and environmental toxins like amines, asbestos, and some benzenes. Then avoid some diseases that can cause HIV, human papilloma. I don't know, some of us have heard of this cervical cancer, human papilloma, and taking more of vitamin D, balance your hormones. Balance your hormones and avoid some conventional sex that can lead to that. The next one I want to talk is about glaucoma. Glaucoma is a group of eye diseases that causes blindness if left undetected. Because some of the times if you look at some people that is blind these days, some of them, their eyes are open, but they are not seeing. Some of them are caused by glaucoma, and glaucoma are irreversible. You don't reverse blindness or any vision lost due to glaucoma. It is not, you cannot reverse it. You cannot bring the vision back. And at times, glaucoma are hereditary, and glaucoma is associated with increase in pressure. And when somebody will ask me what causes glaucoma, glaucoma is caused by its narrowing or blockage of the passageway where fluid that passes to the back of the eye is blocked or narrowed. Those fluids give nutrients to the optic nerve, which are the nerve that give impulse to the brain that make one to be able to see. So when they are not getting the nutrients which they need, they start fading away. Vision are reduced. So some of the times people will complain, I can't see, and glaucoma can cause some symptoms of glaucoma too. Like we have different types. We have the open angle, closed angle. Some open angle glaucoma has no signs, no symptoms. Your eyes you will not have any pain. You will not have any itching, no redness, but you notice that either when you cover one of your eyes, you notice that you are not seeing. But there is another type of glaucoma that comes with pain, severe headache, you cannot look at light. Please run down to meet your eye doctors, because if they do not take any immediate attention on the eye, one can lose the vision. And again, as I said, glaucoma can be hereditary. Your children can have glaucoma, and one can have glaucoma. And the problem about glaucoma is that any vision reduced by glaucoma, you cannot improve that, but will maintain the remaining vision either with medication or you go through surgery, and surgery called trabeculotomy. That will help us to open the passageway where the fluids pass. So the next one I want to talk, and I will quickly rush to it, is hepatitis. Because I know that hepatitis is another one that people overlook. Some causes of hepatitis, as you all know, has to do with the liver. It's a primary culprit lurking behind the liver disease. And it is caused by some viruses, alcohol, and drug. Over-the-counter drug like acetaminophen, which we call paracetamol, so can still cause cancer. So we have different types of hepatitis. We have hepatitis A, B, and C. A are transmitted from food, contaminated food, waters. While B they get hepatitis B from blood transfusion. They pass through, get it through sexually. then through blood transfusion to contaminated needle, and it can still be passed through from mother to child. We have hepatitis C. Hepatitis C is still gotten sexually and blood transfusion, and that C has no vaccine yet. And there's some symptoms of that hepatitis. We have yellow eyes, jaundice, confusion, fatigue, loss of appetite, headache, and nausea. And all these hepatitis can be detected through blood tests. And the treatment, you use antiviral. So it's better to treat hepatitis because at times it causes liver damage. And we all know when your liver is damaged, the next thing. So it's better to prevent some of these, some of the causes of these hepatitis. Or when you see a warning sign, please rush down to the hospital to see your physician. So another thing I want to talk little about is about stress, because some people overlook stress. Stress causes a lot of things to the body. Stress causes a lot of things to the body which we overlook, because we all mothers will try to do this one, want to finish this one, we've not done this one, but at times some of this stress causes a lot of things, like poor sleep. Stress can cause poor sleep, can cause a change in circulation. Your circulatory system will change. Stress can cause some indigestion. Stress can cause a gastrointestinal system. Gastrointestinal system is a system that helps in processing of food. You see some people having some running stomach. It can cause insomnia. What I mean by insomnia is lack of sleep. You don't have sleep. It can cause lack of sex drive. It can increase infection. Stress can cause high blood pressure when you don't have enough rest and peace. Then stress can still cause diabetes when you are not feeling well, obesity, and stress can give you impotence. A woman that is waiting to conceive, and when you have and you indulge in a lot of activity that doesn't give you time and rest, can still lead to that. And there's some things that you do to alleviate the stress. Just cut off some things that contribute to your stress. Then relax and take more of time to sleep. Breathe, and if possible, massage, maybe from your partner. There's some social activities, like where we are. Some people say, we are wasting a lot of time. So this is still a lot of you, but it will make you to forget some things. Then stress, you can still alleviate stress with good nutrition, good food, and sleep well, as I said before. Then avoid some substances like alcohol, caffeine. Some people like coffee, it's their best tea. So you reduce a lot of things like that. So thank you so much. I want to stop here because of the time given to me.
Thank you so much, Doctor. We appreciate the lecture and the information given to us. Do we have question and answer? Do we have questions so that she can answer them for us? Sorry. Questions. Does anyone ask question? Okay, I have 2 questions here that I'll be reading them out and she will answer. In case you have question, you can still write them and give to the usher so that she can quickly answer the question. Sorry, we are rounding up. Okay, mommies, please be patient. We appreciate your patience all this while. May God bless us in Jesus' name. All right, question 1. Can stress alone cause high blood pressure? Just only stress? No, only stress. Can it cause high blood pressure? And the other question I have here is, how best can we prepare our vegetable? I mean the regular efo riro, the efo tete, and that we buy in the market. How best can we prepare it? Some people said if we cook the vegetable, that all the nutrients will be gone. Kindly enlighten us on how to cook our efo riro in a way that is going to be edible and at the same time still delicious for us to eat. Thank you, doctor.
Thank you so much. So the question number one is, can stress cause high blood pressure? The answer is yes. Stress can cause high blood pressure. You know, when we are mentioning about stress, maybe the word stress look either is too big or I don't know. Stress can cause high blood pressure when you don't have rest. Okay, I can use myself and as an instance. I traveled, that should be 2 years ago. I had a lot of stress, and even my house help, I have to even take her back because she was misbehaving. So I passed through a lot of stress, and I spent the time, my vacation, I spent almost all the time. So immediately I enter Lagos, the next day I need to resume work. So I have no time for myself. So I resume work. After 1 month, 2 months, I noticed that I start having pain on my chest. So I was disturbed. I said, what's all this? So after which, I was now, because of that, I checked my BP. My BP was a bit high because of that. So I was bothered. So that lead me to check my cholesterol. So my cholesterol level, okay, it's not cholesterol, lipid profile. Because cholesterol is inside lipid profile. There's a lot of things. So it was normal. So my colleague now told me, it seemed that you need to rest, it's stress. So I have to take off work, off duty, 4 days off duty to rest and sleep, because me, I know that I'm already stressed out and I needed that rest. And after which, my BP normalized. And can you imagine you being on that situation and the BP, and you might not even know what, maybe you go and drink agbo, and you might not even know what you are passing through. Before you know what is happening, you start having BP. And when you start having BP and start taking BP drug, you continue. So it's better to prevent it. And some of the time you might not know, which might lead to heart attack and might lead to death. That is question number one. Number two is the eforiro. Because I noticed that a lot of people, before they cook the eforiro, they take hot water and pour inside and remove the greenish part of the veggies that you need to take. After you throw it away, you now boil and cook the remaining one, which is what you are eating is not even vegetable at all. Maybe you are just trying to enjoy the fibers that is remaining, because you are not taking it. It's the chlorophyll that is inside there that give you blood and give you some vitamins which you need. Thank you.
Thank you so much, doctor. I hope we heard a lot of people are guilty of that eforiro part. Also number one, people that is guilty of that eforiro part. If I do not boil my efo with hot water, I'm not cooking efo. But thank you, doctor. I'm going to try it out, and then I want to believe it's going to be delicious. Praise the Lord. Now we are moving to the last agenda for the day, which is the empowerment program. It's going to be very short. It won't take lots of our time at all.